Hello everyone, I'm Dr. Demchenko, and today we'll discuss the condition of sacroiliac joint and pelvic instability. This is a very acute problem which most often occurs in women after childbirth or is traumatic after falling on the buttocks or landing on one leg. The treatment of this condition is mainly in the plane of rehabilitation, and today Michael will show and tell what to do if you have such a problem.
Hello everyone, today we'll discuss the instability of the sacroiliac joints. If we look at the anatomy with you, the sacrum is wedged between two iliac crests in its own way. And such a condition as instability is not that it tells us that it really starts to move excessively. Overall, there is not so much free range of motion in this joint. More often we talk to you about some kind of mechanical irritation or about the instability of the joint surfaces themselves of the acromioclavicular joints or the surrounding ligaments. The whole complexity of this problem lies in the fact that it can erode, that is, give pain not only in the sacral area, but also go to the lower back and give reflected pain down the surface of the thigh. Unlike the lower back, most often such pain occurs directly while you are sitting or standing, that is, you are in some static position which requires direct mechanical stress of the sacroiliac joint itself or its ligaments. To determine if this program can assist you, conduct a provocative test, which is performed with the help of a regular fitness suit. We hold it slightly above the knee, and after that we perform several active movements that usually cause pain. It's either a tilt or a bend or a weight shift to one leg or to the other leg. If your symptoms react in any way to this movement, then in such a case our program can help you.
The first exercise we will start with is modified waist lifts using a regular belt or a yoga belt.
We secure it above the knee so that you can spread your legs approximately shoulder width apart. In this position, our heels are also shoulder width apart and the knees are bent so much that they can reach the heels with the tips of the fingers. At the same time, the legs are evenly positioned, the feet are sufficiently parallel. After this, we create a strong enough tension on the recoil so that the belt is stretched. And after this, we start slowly performing the hip lift so that the hip aligns in one line with the knee and shoulder. After this, we perform a slow lift so that the cross arches the floor, but we do not relax at the bottom point. For one approach, we perform 10 to 15 repetitions. One of the key mistakes is when our feet are wide enough, but the knees are as if they were bent inward. In this case, we may feel an overload on the back surface of the thigh or an intensification of symptoms. To do this correctly, place your feet a little narrower or slightly extend the length of the belt so that the knees can be a little wider than the feet. The second mistake is insufficient lifting of the pelvis, when your efforts at first glance are only enough to lift the pelvis so that it cannot rise in line with the knee and shoulder. Under such conditions, you can provide slightly less resistance to the tension of the belt and place your hand on your waist from both sides so that you can also sensorially track the trajectory of the pelvis movement, as if slightly helping yourself with your hands. And finally, the last mistake when we start the movement with an over-twisted waist. And with this, a large part of the movement volume occurs in the lumbar region, not due to the bending of the hip joints. your hands will be your best guide in this situation. Slightly shift your pelvis to find a neutral position and maintain it throughout the entire lift. To a large extent, you should feel the tension in your glutes and the back of your thigh. The second level of difficulty of this exercise is when we start already from the position of a raised pelvis. In this case, your hands can be on your waist or they can lie on the floor. After this, we start to lift our legs up one by one. In this variant, it's not so important how much the knee bends. The main condition of the movement should be painless. And the position of the pelvis should still be quite high. The main mistake when we perform this movement is with the rotation of the pelvis towards the supporting leg. In this case, it's better to use your hands to control the position of the pelvis in space. The third difficulty level is a simple modification of the second, starting from a raised position. Pelvis, our hands are completely hanging in the air, and at the same time the pelvis is raised to the end and the leg straightens only to the horizon, that is, it aligns in one line with the flatness of the body. And finally, the fourth level of difficulty, when the leg, for example, our right leg is initially already on the half, the muscle is stretched towards us, and after this we start to perform lifts of the pelvis so that the leg remains bent all the time to the flatness of the body. Don't forget, at the bottom point we don't give full relaxation. The first variant of the exercise will be performed on the skeleton without additional equipment. We stand on the elbow so that our supporting leg almost touches the elbow with the knee. Our second leg is slightly retracted in this position. We lift it, and as if we are pushing an invisible platform. While doing this, we use the maximum possible effort. The higher your imagined platform is, the better the result will be. During this movement, the pelvis should not tilt to one side or the other. Use a neutral position. To enhance the effect as a level of difficulty, you can use a regular rubber band. For convenience, I recommend you to fasten a regular strap in the middle of the foot and the other end to the elbow of the opposite elbow. And after that, perform the same movement. The second level of difficulty of this exercise will be a full fall back. We also leave our hands on the waist to control the position of the flatness. We shift the weight to the bent leg and also start to take the leg back, trying to fully lower the knee to the floor. In this case, the knee may slightly go beyond the toe. This will not be considered a mistake. However, the weight should be evenly distributed over the entire foot. A typical mistake is either a lateral tilt of the body or the knee collapsing inward. Therefore, if you can't control the position of your body or knee well enough, use a partial range of motion to gradually learn to hold your knee or hip throughout the entire range of motion. And finally, the third option for intensification, when we use additional resistance with you. In this case, it will be a regular shock absorber. Of course, you can also use dumbbells or kettlebells, but rubber will be the best option because it has variable resistance throughout the amplitude, which will be much more important and interesting for us. We perform the same movement, hook the rubber band on the support foot and pull the upper edge through the elbows, holding them at shoulder level. After this, we perform the same drop. How will our program be structured? In the submenu, we choose the necessary difficulty level at which we can perform about 10 repetitions. We performed the exercise 2 to 3 approaches so that it was hard enough for us, but at the same time you could perform it qualitatively and did not experience strong tremor, that is, shaking of the limbs during movement. You use the drop on each side, that is, on the left and right leg, also at the level of about 10 repetitions. And at that level of difficulty, which you are now able to perform, there's nothing scary if you can't perform 10 repetitions. 6 or 7 will be enough. But you'll need to perform this program not twice a day, but at least 3 to 4 times to still quickly achieve a good result. As a result, we get about 6 to 8 work approaches that need to be performed twice a day. Also, if you experience one-sided pain in the hip or leg, you also add 1 or 2 approaches to this program of one-sided exercise, performed on all fours, also necessary for your level of difficulty. You should feel a noticeable result by the end or middle of the second week of exercise. This will mean that you have a good prognosis and you should complete this program for at least 6 to 8 weeks, preferably go through the full course up to 12 weeks or until you can perform the last level of difficulty approximately on 10 to 15 repetitions. If your problem could not be moved from its place, then most likely it is multi-component and requires a more detailed analysis. And finally, in rare cases, it happens that when the effort is increased in the lift of the pelvis, a person begins to experience an intensification of symptoms instead of relief. There is nothing scary about this. In some rare cases, it will not be the abduction of the thigh and the intensification of this movement that will help you, but its reduction. In such a case, at the first level of difficulty, instead of using a belt, take a small fitness cube and, just like in the test, hold it between your knees with enough force and perform hip lifts. To be continued.